Good morning. I want to acknowledge we are gathered on Treaty 6 territory, and I also recognize the Métis people of Alberta who share a deep connection to the land. I'm joined today by Jackie Bain, whose mother experienced a very distressing situation when trying to get emergency medical help. We'll hear directly from Jackie in a moment. In October, Daniel Smith told Albertans her plan to fix the health system within 90 days would be, and I quote, bumpy. It's well past her 90-day pledge, and there has been endless chaos in Alberta healthcare. With Daniel Smith at the wheel, the road to fixing healthcare has been and will continue to be a treacherous journey. Hundreds of thousands of Albertans are still without a family doctor. Dozens of rural hospitals are partially closed because of staff shortages, and ambulance delays are getting longer and longer because of the unrelenting chaos created by Daniel Smith and the UCP government. For example, last week the UCP said that some 911 calls would now be transferred to 811 to help ease the burden on emergency services. It's clear that this badly managed transition has put patients at risk. I will now turn it over to Jackie.
Thank you, Lori. I'm here because I don't want what happened to my mother to happen to anyone else. At 92, my mom is still active and engaged in living out her best life. But last week, my mother was sick. She lives in an independent living facility where staff do check on residents each morning. When they went to see my mother, they were having difficulty waking her up. I was able to speak to my mother on the phone, and she was saying how weak she was and that she could barely stand. I went right away to go see her, and she said she needed to go to the hospital. I knew something was very wrong because she never wants to go to the hospital. I called 911 and told them my mother was weak, dehydrated, and everything was going completely through her, that she could barely stand, let alone walk, and felt like she was going to pass out. The 911 operator said she was going to switch me over to 811 so they could assess the call. I was asked to give the phone to my mother. They asked if she had chest pains. She said yes. They asked if she had any breathing issues. She said yes. She was telling them how weak she was, that she couldn't walk, couldn't eat anything, and then she put me back on the phone. I was told to take her to see her doctor, her GP. There was no way she could go to the doctor. And what could the doctor do? She needed emergency medical help, but how was I supposed to transport her to the hospital when she was so weak, and I was fearful that she might pass out en route? They offered a few suggestions for car transport, but I was worried about how I could get her into any vehicle, especially being winter. So they suggested I call a medical transport agency to take her. It was extremely frustrating, and my mother was in distress, so I gave up. I helped get her dressed and very carefully got her to the car and took her to the emergency at the Misericordia Hospital. If she had been taken by ambulance, she would have been transported on a stretcher, but that's not how it worked out. So she spent the entire day at the emergency, slumped over in a chair before she was admitted. She's still in the hospital and probably will be there for another few days, so it's been well over a week. If we're faced with an emergency again, I don't know what we'll do. That experience was very stressful and degrading. I did get a call yesterday from a lovely lady at AHS who finally took the time to hear my full story, and she said they would be investigating what happened with our situation. I don't want to lay blame on anyone. I just don't want this to happen to anyone else. The 811 system can work for certain scenarios. As myself, I have used it in the past for our family for different scenarios. I do hope this 811 system gets sorted out because we don't need to add to the crisis to our healthcare system. It really feels like healthcare in our province isn't just broken, it's absolutely shattered.
Thank you, Jackie, so much for sharing your story. Your mother is so fortunate to have you advocating for her. There's a lot of attention on the premiers and the Prime Minister meeting today to discuss healthcare at a very high level. We're going to be hearing about many billions of dollars over many years, but it's critical to remember that what matters in healthcare is what happens to Jackie and her mother and millions of other Albertans. When we need help, will it be there? When we need help, will we be forced to pay for it? Alberta is running an unprecedented budget surplus right now. We are not short of resources. But when Jackie called for help, it didn't come. And they even suggested she should pay for someone to help her. Daniel Smith and the UCP cannot be trusted with healthcare. And the Alberta NDP will end the UCP chaos in our hospitals, ambulances, and clinics. In the weeks ahead, we will roll out our plan for family health care. Our plan will ensure all families can get the care they need when they need it close to home. We will work with paramedics to bring in better reforms for EMS based on the solutions paramedics are calling for. And we will launch the largest healthcare recruitment strategy Alberta has ever seen. It's time for an Alberta NDP government that will put public healthcare first. Thank you, and we're happy to answer your questions.
Thank you. Just a reminder to everyone on Zoom is the raise hand function. If you have a question, if you're on the phone, it's star. Your line is open.
This way. I'm just hoping to understand the timeline a bit. So when was that initial 911 call? And when was it that you took your mom to the hospital?
Initially, I believe the first call was at her facility, which was January 25th. And then she had another episode on the Friday a few days later, and I called 811 directly and was told to go back to her doctor, to her family doctor, and took her to the Devon Hospital on the Saturday. She was on fluids, 500 mLs, and they sent her home with a sample, which I dropped off on the Sunday, and the Monday called me in distress. So I immediately went there and called 911 and was again rejected, or switched to 811 and rejected.
Do you have a follow-up, Catherine?
And then you mentioned, or maybe it was Lori who mentioned, being asked to pay for a medical transport. So they didn't want to send your mom by ambulance, but they suggested like an emergency transport, or what?
Yes. Yeah, they, I said, how can I physically do this? I said, she's weak, everything's just going completely through her, and she started suggesting scenarios, how I could arrange my vehicle, or said, oh, maybe you could call a medical transport company to come and take her, which I wouldn't even know where to start.
Does that answer your question, Catherine, or do you have another one?
That answers everything. Thank you.
Thank you.
Okay, we'll just do one more pass. Oh, we have someone on the line. Go ahead, caller, your line is open. Please state your name and outlet and who you'd like to direct your question to.
Hi, my name is Lisa Johnson with the Edmonton Journal. Sorry about this situation that happened to your mother, Jackie. I just am wondering, and this might be too personal a question, but what was your mother ultimately diagnosed with, and what was the final situation there? Like, why was she taken to hospital? Why was she admitted to hospital ultimately?
So just to give you a little bit of backstory, she was also, has a blister pack and had some Imodium in it. Wasn't working. I was in contact with her pharmacist. They know me very well there. And she told me the maximum she could take, so she was also supplementing with that. I spoke to the doctors and nurses, I have to say, have been fabulous. Like, they're run off their feet, but they're fabulous. So her doctor contacted me, I believe it's the third time, was yesterday, and said it's a form of colitis. which years ago she was hospitalized in Calgary for, so it's come up again. If she was to have been referred by her doctor to a GP, probably a 6-month wait, and probably wouldn't be here now. And so that's what the final thing is. They're treating her with steroids right now. Hopefully, in a few days, she'll be out. As of yesterday, it's been a full week that she's been hospitalized there. Does that answer your question? Did you?
Yeah, thanks very much, Jackie.
Thank you.
Do you have a follow-up question?
No, I'm good, thanks.
Okay. We'll just do one more pass for questions. Reminder, if you're on Zoom, let's raise hand. If you're on the phone, it's stop. Okay, looks like we're done for today. Thank you very much.
Thank you.
Good job.